Thank you, Madam Presiding Officer. In the month of April, at the Roxborough Health Facility, we had 7 new patients who were seen via the gynecological clinic, OBGYN. We had 2 new general medicine patients. For May, we had 39 OBGYN and 16 medicine. Thank you.
Minority Leader.
With respect to renal, urology, and the other services that weren't mentioned, is it that, do you have the figures for those?
The figures that I have provided are the figures available.
What's that?
Secretary.
The figures that I provided are the figures that are available.
Is it that persons went to access those services and were unable to access those services?
Secretary.
The process that is used to admit new patients into the outpatient clinic at the Roxborough Health Facility is one that is based on referrals either from the health centers in the district or from individuals who live in the area who currently attend clinics in the Scarborough district. Every person who has been referred to the Roxborough Health Facility thus far has been seen by the professionals in their respective fields.
Can we confirm that on the staffing organization, we currently have renal staff to provide renal services, urology, and the others that weren't mentioned?
Madam Presiding Officer, I will answer. It is important for us to recognize that this administration came into office in December 2021, when in fact this Roxborough Health Facility was commissioned and was opened over a year ago. I am sure we all remember that the Prime Minister came up to an opening, and since then, we have not been able to provide renal services at the facility. The leadership of the Tobago Regional Health Authority is continually managing the recruitment of specialist physicians in Tobago. We've been here for close to 6 months. The dialysis team that has been recruited for the Roxborough Health Facility have been undergoing training over the last couple weeks. They are now ready, given that the dialysis machines are brand new and the technology associated with the dialysis machines were actually brand new. They are now ready to start accepting patients that are referred from the dialysis center at the Bacalet Health Center to Roxborough from next week. We have been working to ensure that the transition of specialist patients is done in a seamless manner. As a result, there are policies that are currently being developed that speaks to the implementation, that speaks to the actual functioning of each of these specialist clinics at the Roxborough Health Facility. My time, Madam Presiding Officer, indicates that even though there was a huge opening for this facility years ago, this process is now happening because the process has begun. A medical chief of staff was hired late last year to start managing the hospital process. Pediatricians will be available at the Roxborough facility from June 1st, and those referrals are being set up as we speak. Patients from the eastern communities who have been attending specialist outpatient clinics have currently been transferred, and they will start seeing nephrology and internal medicine from next week. The required health professionals to facilitate them being seen appropriately will be available at the facility from that time.
Minority Leader, again, your persistence precedes you. I think that the Secretary have answered all the questions. Any further questions, you can get it in writing from the Secretary of the Division. Let's proceed. Next question.